intact. We're gonna check for pupillary light reflections. I'm gonna check for direct and indirect consensual light. Okay, her direct and consensual light reflection is intact. I'm going to check for the eye movement. I need to follow my this pen tip and do not move your head. EOM function is intact. Cranial nerve 346 is intact. We're gonna check for the red light reflux. It's better in the dim light room. I need you to look at the window there. I'm gonna place my hand on your shoulders. Okay, red light reflex is intact. I also check for the behind the eyes, looking for the macula, blood vessels, and optic disc. It all looks good. There's no hemorrhoids noted. Now I'm moving to the face. I'm gonna palpate for the temporal pulse. Temporal pulse is 2+. I'm gonna check for TMJ. Open your mouth and close. Cranial nerve 5 is intact. I'm gonna check in for the ears, looking for the symmetry and any tenderness. No. Okay. I'm gonna check for the inner ears. We're looking for any wax buildup and looking for the temporal membrane. Okay, I'm gonna pull the ear up and back. Okay, good. There's no earwax buildup and ear canal is clean and patent, and temporal membrane is a light gray colors and cone of light, and landmark is present. And I'm gonna test for the hearings. I'm gonna ask her cover your left ears, and repeat what I'm saying.
1, 2, 3.
Okay, I will repeat on the other side. And next, I'm going to check for the Weber test and place my tuning fork in forehead. Tell me when you hear in the pulse ear or one ear.
2.
Okay, good. I'm going to place this tuning fork behind your ear. Tell me when you stop hearing it.
Stop. Stop.
Okay, air conduction is longer than bone conduction, which is normal. We will repeat in the other side. Now we're moving to the nose. I'm gonna inspect the nose, looking for any deformities, any drainage, and I'm checking for the inside of the nose. Mucosa is pink and moist. Septum is in the midline. And we're gonna check in for the patency. I need you to cover one nose and close your eyes. Tell me what do you smell?
Lavender.
Okay, and the other nose.
Citrus.
Okay, her nose is asymmetries, and trachea is in the midline. And I'm gonna palpate for any tenderness. Trachea is smooth. And I'm gonna do the thyroid check. I'm gonna do from the front side. I'm gonna place my finger here and just swallow. Okay, her thyroid movement is smooth. There's no hardness or tenderness noted. Okay, we're gonna check for the shoulder movement, which is cranial nerve 11. I need to snuggle your shoulder up. Okay, good. And the face, resist. Okay, cranial nerve 12 is intact. For check for cranial 11 is intact. For the cranial nerve 12, I need you to stick your tongue out and move up and down, side by side. Good. Cranial nerve 12 is intact. Now we're moving to the thorax. I'm looking for her breathing. No distress is noted. Chest rise and falls symmetrically. There is no abnormality noted. I'm gonna palpate for any pain, tenderness, and air trappings. Okay, now I'm gonna checking for the tactile fremitus, and you say 99.
99, 99, 99, 99.
Okay, tactile fremitus intact, and then I'm gonna percuss side by side. Okay, next I'm gonna listen to the lung sounds, looking for any crackers or wheezings side by side. Now we're moving to the cardio. I'm gonna checking for the pulse. Bilateral pulse is 2 plus. And I'm also gonna listen with my diaphragm and the bells. Hold your breath quick. No bruise noted. I also gonna listen for the bell. Okay, there's no bruise noted. I'm gonna inspect for the chest area for any abnormalities, any pulsations, any thrills, and I'm gonna palpate for any tenderness, and then I'm gonna listen to her heart with my diaphragm and bells, and just normal breathe, and aorta, pulmonic, Erb's point, tricuspid, mitral. I'm gonna repeat with my bell. Heart sound is normal, S1, S2, there's no murmurs noted. The PMI point is in the left side of chest, middle of the clavicle line, and the width above 5th ICS. There's no pulsations noted. And now I'm gonna check her heart sound in her lying positions. Can you lie down, please? Alright, I'm gonna listen one more time. Heart sound was normal. Now I'm gonna check for the pulse, and also looking for skin is warm, and I'm gonna also checking for okay, oblique pulse, posterior tibia, and dorsalius pedals. It's all 2 plus, which is normal. Now I'm gonna check for the abdomen. I'm gonna raise the leg a little bit, okay? Okay, I'm gonna inspect for any symmetry. There's symmetricals and umbilicus in the midline. There's no voluntary movement is noted. I'm gonna listen for the vowel sound in all 4 quarters. Also gonna listen for aorta bruise. Okay, vowel sound is present. There's no bruise noted. I'm gonna percuss. Okay, it's good. I'm gonna percuss to make liver spans. Hold it. Okay. All right. I'm gonna measure it. It's about 6.5 centimeters. The normal range is 6 to 12 centimeters, which is in normal range. And I'm gonna palpate, light palpate for the tenderness. Any tender? No. Okay, I'm gonna deep palpate for the checking for livers, spleen, and the kidney. It's not palpable, which is normal. Now we're gonna check for the muscular systems. I'm gonna look for the arm bilaterally and looking for any tenderness, any edemas, any muscle mass. Her skin is warm, there's no muscle mass noted. I'm also gonna check for shoulders, no dislocation or edema, tenderness noted. I'm gonna check for the range of motion. I need you to follow me do some movement, abductions and adductions, and raise up like this and up and down and up. Put your arm and extension and flexion, okay, and do twist, okay, and your wrist up and down, side by side, and then turn around.
Respirations. Is it okay if I put my hand on your back? All right, go ahead and breathe for me. Okay, 30 seconds has passed. Your respirations were 16. So the rate, rhythm, symmetry, and depth were appropriate. No abnormalities noted. The mode of breathing was appropriate, and the patient is sitting upright. Okay, now I'm going to assess for clubbing. So I'm just going to have you put your fingers like this. I'm going to see if there's a diamond shape in the middle of your fingers. Good. Okay, now I'm just going to inspect your hands. Fingers look good. Doesn't look like there's any clubbing. Okay, now I'm just going to have you flip around, and I'm just going to inspect the back of your chest. Just going to pull your shirt up a little. Okay, so I'm just inspecting the accessory muscles. Okay, now I'm going to assess your AP diameter versus your transverse diameter. So I'm going to go right here to here. Okay, that is even. Now I'm going to inspect for any lesions. There are some macules noted along the back. They're evenly distributed. The size, shape, color, depth, and elevation are similar. Now I'm going to point out this macule right here, which is a mole. I'm going to compare it to the one right above it. The color is similar. The size and shape are similar. The depth and elevation are similar, and the posterior chest is symmetric. Okay, now I'm just going to palpate your back for any tenderness, so just let me know if you feel any tenderness, okay? Feel any tenderness?
No.
Okay, and I didn't feel any masses. Okay, now I'm going to place my hands on your lower back just to check your chest expansion. I'll just have you breathe in. Good, okay. Now I'm going to check for tactile firmitis. When I put my hands on your back, I just want you to say 99, okay?
99, 99, 99, 99, 99.
Good, there were vibrations when you said 99. All right, now I'm just going to percuss your back, so I'm going to tap on your back. Good, okay. Now I'm going to auscultate your back, so I'm going to place my stethoscope on your back and just listen to your lungs. Good. Okay, the pitch and intensity of your breathing was appropriate. Didn't sound like there were any abnormal sounds. And then the inspiration and expiration of your breathing were equal. Okay, now I'm going to do that again, but when I place my stethoscope on your back, I want you to say 99, and I'm going to test for bronchophony.
$99, $99, $99, $99, $99, $99, $99, $99, $99, $99, $99, $99, $99, $99.
Good, okay. It sounded clear and didn't sound like there were any crackles, and it doesn't look like there's any deformities or bulges. Okay, now I'm going to have you turn forward, and I'm going to inspect the front of your chest. Okay, I'm going to palpate your carotid arteries. Good. Okay, the rate and the rhythm and the depth of them were appropriate and even. The pulses were symmetrical, and it didn't feel like there were any thrills. Okay, now I'm going to palpate your chest. I'm going to palpate your precordium with my fingertips and then the palm of my hand, okay? Good. Okay, now I'm going to do the palm of my hand. Good. Okay. Now I'm going to auscultate your chest. Actually, I'm going to palpate your apical pulse. So I'm going to have you lay on your left side with your left arm up. Good. And I'm just going to feel right here. Good. Okay, go ahead and sit down again. And now I'm going to auscultate your chest. So I'm going to do it in that ladder again. Good. Okay, the pitch and intensity of your breathing was appropriate. Didn't look like there were any abnormal sounds, and then the inspiration and expiration of your breathing was equal. Okay, I'm going to do that one more time, ape to man. Good. Okay, again, the pitch intensity of your breathing was normal and appropriate. And
Your right elbow up on the table. And can you bend your wrist forward as far as you can go? Is that as far as you can go?
Yes.
Okay. And now I'm just going to push it down to see if it can go any further. Okay. Now, can you bring your wrist back the other way? Go ahead. Is that as far as you can go?
Yes.
Okay, I'm gonna push down a little bit. Okay, you can relax. Okay, now with your hand flat on the table, can you move it as far as you can towards your thumb? Now I'm going to try to move it a little bit more. Okay. Now this time go towards your pinky. Now I'm going to try to help you move a little bit more. Okay, very nice. Okay, now with your elbow back up on the table, try to touch the palm of your hand with your fingertips, just like that. Okay. And just like last time, I'm going to push down a little bit more on your finger. Okay. Okay, I'm going to push down. Okay, just hold that there. Okay, I'm going to push down. Okay, and I'm going to push down. Okay, you can relax. Okay, now we just have a couple more. With your elbow up on the table again. This time we're going to make a kind of like a claw. Yes, there you go, very good. Okay, now I'm going to push down. Okay, hold that there. And push down. Okay, push down. Okay. Now I'm just going to do the same thing right here with these little fingers. Okay. Okay, you can relax. Now, can you face your palm up? And what I'm going to do is just hold this right here. And if you can, try to bring your fingertip to the base. Okay, and you can bring it back. And your next finger. Okay, very good. And the next one. Very good. And the next one. Okay, looks very good. Okay, now if you can just lay your hand flat on the table, just like that. Okay, so she has full extension in her MCPs, PIPs, and DIPs because they're completely flat on the table. Okay, so now we're gonna take some measurements in your thumb. Just lay your hand on its side and bring your thumb away from your hand, like that, as far as you can. And this is as far as you can go, correct?
Yes.
Now if you can lay your palm down flat on the table and bring your thumb away from your hand as far as you can. If you can flip your hand over for me and bring your thumb in and bend both of those joints as far as you can. Okay, now with your hand flat on the table, try to touch your thumb to the tip of your pinky. Okay, and now touch your thumb to your next finger. Okay, now touch it to your middle finger. Okay, and now bring it to your pointing finger. Okay, so we're going to test the muscle strength in your fingers, your wrist, and your thumb. So we're going to start with your wrist, and with the back of your hand down, bring your hand up and towards your pinky side. Okay, hold that there and don't let me move you. Okay, now same thing but towards your thumb side. And hold that there and don't let me move you. Okay, now we're gonna flip your hand over. And now bend your hand up this way and towards your pinky side. Hold that there and don't let me move you. Okay, now towards your thumb side. And hold that there and don't let me move you. Okay, now lean forward towards your arm and move it back towards your thumb side a little bit. Now hold that there and don't let me move you. Okay, bend your index finger and hold it there, don't let me move you. Okay. Now bend your middle finger, hold it there, don't let me move you. Okay. Now bend your ring finger and hold it there, don't let me move you. Now bend your pinky and hold it there and don't let me move you. Okay. Now bend your index finger, hold it there, don't let me move you. Bend that finger, hold it there, don't let me move you. Okay. Now bend this one, hold it there, don't let me move you. Bend this one, and hold it there and don't let me move you. Okay. And now, can you move your fingers kind of like a duck, just like this? Okay. Now hold it there and don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Okay, so now can you put your elbow up on the table and face your palm towards me? Okay. Now make a claw just like that. Hold it there and don't let me move you. Hold it there and don't let me move you. Hold it there and don't let me move you. Hold it there, don't let me move you. Okay, now do you know the longhorn sign? There you go. Okay, so I'm gonna push right here and hold it there, don't let me move you. Okay, and same for this one, hold it there, don't let me move you. Okay, so that was normal. So with your hand flat on the table, can you spread your fingers out as far as you can? Okay. Now I'm going to try to push it inward. So hold it there, don't let me move you. Okay, now I'm going to move this one over here. And hold it there, don't let me move you. Now I'm going to move it over here. And hold it there, don't let me move you. Okay. Now hold this one there, don't let me move you. Now you can put your elbow up on the table and squeeze all your fingers together. Okay. I'm going to try to pull it apart and hold it there and don't let me move you. Okay. Thank you. So now we're going to move on to your pinky finger. So if I can flip your hand over like that and bend your pinky just like that, like we did with the duck hand. Now hold it there and don't let me move you. Okay, now I'm just going to hold your hand. You can relax that. I'm going to hold your hand like that and try to touch your thumb to your pinky. Go. And I'm going to try to unroll it, but hold it there and don't let me move you. Okay, good. Okay, now the next thing, spread your fingers as far apart as you can. And I'm going to try to push your pinky finger back in. Hold it there and don't let me move you. Okay, very nice. You can relax. Okay, so now we're going to look at your thumb. So can you put your hand on your on the side for me? Okay. Now can you bend just the tip of your thumb? So hold that there and don't let me move you. Okay. Now can you bend it all the way in towards your palm? Nice. Hold that there and don't let me move you. Okay. I'll bring it back out just like that. And I'm going to try to push it down. Hold it there, don't let me move you. Okay. And now we'll hold right here and push. Hold it there, don't let me move you. Okay. Okay, now we're just going to put your hand back on your side and squeeze your thumb in. And I'm going to try to pull it apart. Hold it there, don't let me move you. Okay, now put your palm flat on the table and spread your fingers apart. Okay, I'm going to try to push it in. Hold it there, don't let me move you. Okay, now flip it over and bring your palm or bring your thumb up just like that. Yeah, there you go. And I'm going to try to push it down. Hold it there, don't let me move you. And last one, just gonna hold your hand like this. Can you bring your thumb and touch it to the tip of your pinky finger? Okay. Now hold it there and don't let me move you.